Okay, well, welcome everyone to the February 10th, 2026 MDDC Policy Committee meeting. I'm Jossie Burksab, I'm the policy chair, and I can go to the next slide.
Do you see the next slide?
Yes.
Oh,
Next slide?
the next slide.
Yeah.
Do you see the presenter slide?
No, I'm still the introduction slide. Introduction
Oh
slide.
dear, what's going on here?
Just the title slide is what I say.
All right, do you see that?
There you
Now I
go.
see the
That's it.
presenter slide, yeah.
You got it.
Okay, well, sorry about that, you guys.
Oh, that's all
Thank
right. Okay, I've already introduced myself, so I'd like the other presenters of our meeting today introduce themselves.
Good
So,
afternoon, everybody. Jennifer Bertrand, Deputy Director here at the MDDC. Welcome, everyone. It's great to see you. Thanks for your patience. Tamara?
Hi, everybody. My name is Tamara Huntley, and I'm here to give you a PCA update, and I'm the self-advocacy liaison for the council.
Liz.
And I'm Liz Fancher, probably the worst person for technology at the MDDC. I'm a program specialist, and I'm here to help present and help with the chat. And nice to see everybody.
We all have technical challenges, Liz, and you're usually a whiz with this, and so am I, but it's affecting more than one of us, so I don't think it's us today. It's just something wonky. And I see that we have some council members too, Jossie, Austin and Paul.
Okay, Austin and Paul, would you like to introduce yourselves?
Yeah, good afternoon, everybody. As Jennifer alluded to, a citizen, um, town, I'm a citizen council member, and it's great to be here with you all today.
And Paul?
Hello, my name is Paul Lutfi. I'm a council member and a parent of a son with cerebral palsy.
Thank you. Welcome.
And Jossie, I noticed Ann Lynch is here as well from the ADA's office.
Yeah, I think we have some partners. So, Ann Lynch, do you want to introduce yourself?
Hi, everyone. My name is Ann Lynch. I'm an attorney in the Civil Rights Division and also of the Attorney General's Office and also the office's Disability Rights Coordinator.
Okay, let me go down and see if we have any other partners here.
I think
We have someone else from the Mass Office. We have someone from the Mass Office on Disability.
Yes, that's right, Camille.
Hi, everyone. I'm Camille Karabayich. I'm a lawyer with the Mass Office on Disability. Nice to see everyone.
Nice to see you too. Okay, I think that covers it. So we can go to the next slide. It's in the chat. All right, this is our agenda for today. So we've already done welcome introductions. Have we put the meeting poll link in the chat yet? We're gonna do that later.
Not yet, and I don't know that I'll be able to use the chat.
There's another slide. The next slide will have the meeting poll link. Jossie, just go ahead and
Okay, all right.
go through the agenda.
Then this is the agenda. I'll go through the mission. Then we'll do a state legislative update. Then we'll have coalition updates. Then a federal update. Then the council and community events, partner updates, the meeting poll link, DD Council public comment, and then our next council meetings. You can go next slide. Okay, I'll pass this on to Jennifer.
Sure. We really value your feedback, and we also do federal reporting. So understanding who's attending the meetings, and we want to know, are you getting useful information out of these meetings? These are all really valuable things that will help us to do a better job. So we're going to drop the link in the chat. If you have to leave a little bit early today and you can't stay for the full meeting, please respond to the survey so that we can help to make these meetings a better experience for you. Thanks.
All right. Well, as you know, we are the Massachusetts Developmental Disabilities Council. And that's a picture of some of us and at a conference of our parent organization, the National Association of Councils on Developmental Disabilities. And I can go to the next slide. And our mission is to provide opportunities for individuals with developmental disabilities and families to enhance independence, productivity, and inclusion. And that's a picture of us at the ADA 35 celebration in Boston a couple of years ago now. Yeah. Or I guess last year, actually. What am I talking about? Anyway.
Awesome. Yeah, time flies.
You go to the next slide. So we are actually part of a network called the Developmental Disabilities Network. We're authorized by a Developmental Disabilities Assistance Bill of Rights Act of 2000. And as you can see on this map, you have the RDD councils, and you have UCEDs, University Centers on Excellence in Developmental Disabilities, which focus on research and training. And you have what are called PNAs, Protection and Advocacy Organizations, which in Massachusetts is a disability law center, but they basically deal with civil rights and legislative and legal representation. And this network exists in every state and every territory. You can go to the next slide. Okay, now I'm going to pass it on to Jennifer for state legislative update.
All right, next slide. So the Massachusetts legislature has about 5 months to finalize bills. The state budget, however, is like the key focus now and through the end of June. Obviously, that other legislative work will happen, but this is a really important part of the legislative process. Massachusetts establishes a new state budget each year, and the formal session closes on July 31st. Next slide. All of our priority endorsed bills have gone to a public hearing where a joint committee has heard public testimony on the bills. And most bills that are on our priority and endorsed lists have received a favorable committee report. So some bills that haven't been reported on, they've been extended until March 18th. And the link underneath, and I'm sorry, I have a little bit of a cold, so my voice might not be 100% today. The link underneath takes you to a list of the dates, the deadline dates for the Massachusetts legislature. There's a lot there. I just put that in for folks that might be interested. We'll be sharing the link to the recording and to the slides after the meeting, so you can always go back and have a peek at those. 2 policies have become law. There was one bill around educational access that was rolled into another bill that's already been signed by the governor. And the historical records bill. There have been a number of bills that have been amended. The supported decision-making bill in the House was amended. There were some amendments that some folks in the disability community have some concerns about. So there's ongoing conversations with the legislative leaders and advocates about those changes. Another bill that was amended was our changing spaces bill for the adult changing stations. And that would limit it only to some public buildings. And it removed the adjustable table provision from the bill as well. Policymaking isn't a perfect process, and typically, you don't have a perfect bill when they are even passed. But you want to open the door, you want to get started, and then you can always build on the work that that has begun. That's typically how things are done in the policy world. The wheelchair bill also had an updated amendment just this week. I was hoping Barbara might be here Barbara L'Italian from the Disability Law Center. They've really taken the lead on that particular bill. But there's still time in the process, and we'll continue to follow them. At the bottom of the page, you'll notice that there's a link to the MDDC website. That's our homepage, that top link. Liz, is it possible for you to unshare and go to that link? We were going to walk them through our website so you know how to navigate to all these really valuable policy resources we have created and put together in sort of like a little library on our website.
I can give it a try. I don't know.
We'll try once. If not, once you get
Okay.
these links, you can go on and you can navigate. And the other two links at the bottom is one is a direct link to our policy resources where all these spotlights and fact sheets are, and the very bottom link takes you directly to that list of priority and endorsed bills.
It's just very strange because I can't see the Zoom link on my computer anywhere.
All right, that's okay. Why don't we go to the next slide?
I can send out, I have like a list of all the links I was going to put in the chat, and I can send that out afterwards.
Sure. I mean, we're going to share the slides. Austin?
Austin. Oh.
Jennifer, if it's possible, can you put the mouse under the PowerPoint so I can visually follow what's being displayed on the screen?
That's a great suggestion, Austin. Liz is sharing the screen. So Liz, are you able to highlight the bullets as we go through them? We're having some technical challenges today, Austin, and we might not be able to.
I'm sorry, I'm like the worst person to be
Then-
running this show.
That's okay.
I'll try.
If not, it's not a worry, but it would be helpful if you can. But if not, I completely understand.
Yeah, the problem is it's just something really weird is going on with our PowerPoint. Like this is not the view I usually see that I'm showing you, so I don't know what's going on here. But,
Okay, I can be adaptable. Roll
Thank
with
you,
the
Austin.
punches.
Okay.
All right. So on the screen oops.
See, I tried to highlight and it flipped to the next page.
To the next slide. I don't understand why it's doing that today, Austin. I'll let you know which bullet I'm on as I speak. How about that verbally?
Thank you.
So underneath where it says state budget update, there's a screenshot, a picture of a graphic that's on the general court website. And it shows the process of the state budget, how the state budget makes its way through the process and then, ultimately, hopefully becomes law. It starts, you can see in the left-hand side, it's highlighted, it says governor's budget. The governor has now officially submitted her budget proposal in the House. And each year, well, I already mentioned that, each year, the top bullet, each year policymakers create a new state budget. And the second bullet, the annual state budget process begins in January. And then the third bullet, the governor files the budget bill in the House. And then the last bullet, this is known as H1, House Bill 1. On the left-hand side, you'll see something that says governor's budget. Once you have the slide deck, if you click that link, you can go directly and see like her budget. In the orange box on the screen, when you click there, it's just some more information to learn about how that state budget process works. But for all intents, for the purposes of today, it starts with the governor. She has submitted her proposal to the House. And then from there, it goes along all of those steps that you see in the graphic that's underneath state budget update on this slide until we arrive at a final budget. And we're going to follow this through the process month to month each time that we meet. But right now, the governor's proposal has been prepared and it is now in the House, and the House will take it up next. Next slide. So there's some really good things that are in this budget that might be important to you if you have an intellectual and or developmental disability. These numbers, I was able to get them from the ARC of Massachusetts. they did a really comprehensive budget analysis on many of the line items that are important to individuals with developmental disabilities. Now, in that list of bullets, Austin, you see some numbers, 37% increase. So autism omnibus, there was a 37% increase to that budget line item. And it's my understanding that more people with autism that don't have an intellectual disability will be served. And many of these folks have multiple complex type of needs. The other increase that we saw was in that community day work. That's the second bullet, Austin, where you see the 9%. There was a 9% increase there. So everything in this list were things that were increased. The third bullet down is 7% increase, and that went to state operated homes. And the fourth bullet, 6% increase in respite and family support. There was a 2% increase in community residential programs. And then in that last bullet, we've been told that there'll be adequate funding for DESE, DDS residential placement prevention program. And then that link at the bottom, when you have the slide deck, will take you to the ARC of Massachusetts. They have much more information and more explanation about the budget and their analysis of the governor's budget. So, these are very positive things. These are good things that we definitely are appreciative that governor prioritized for our community. Go to the next slide.
I was just going to add the DESE DDS, that stands for Department of Elementary and Secondary Education and the Department of Developmental Services. So it's a partnership between those two agencies for younger children, students who need residential placement or who need supports in order to not be placed in residential settings.
Go to the next slide.
Do you not see it? Chapter 5.
Now I do.
Okay.
So another positive thing that was in the budget was that the Chapter 257 workforce rates, there were no cuts. But I thought it was important to note, and something that was included in the ARC of Massachusetts analysis, that the proposal has level funding. However, it doesn't match the 53rd percentile of the Bureau of Labor Statistics, or the BLS. Based on the ARC of Massachusetts proposal, based on the ARC of Massachusetts analysis, an additional 85 million would be needed to secure the rates at that 53rd percentile. There's more information about that on the ARC's website. The link was included in the previous slide. And then the Mass Health budget. This is a really large portion of the state budget. And the governor proposed 22.7 billion for this upcoming fiscal 2027 year. In fiscal 26, it was 22.1 billion. So there's been a little bit of an increase there, but they've also put into place some spending controls. And this is due in part to the federal, largely to the federal Medicaid funding cuts that we're expecting as the One Big Beautiful Bill Act, or sometimes you might hear it called HR1, or the Reconciliation Bill, is put into effect or implemented. So in Massachusetts, in this budget proposal, there is a rate freeze where there would be no more increases at this time for those rates. And then it would also not allow the expansion of optional programs that aren't required by federal law. So, that's something that we're going to watch, and is something that we're going to help to educate and advocate around. Next slide. So I thought it was important to just talk a little bit about that federal bill that is making some really big changes to Medicaid. The federal government is limiting who can access public health insurance, the Medicaid expansion. And Massachusetts has to prepare to implement the rules or the policies in that One Big Beautiful Bill Act. So there's a cost to complying with the bill. And once it's fully phased in, Massachusetts will lose $3.5 billion a year in federal health care funding. The state will have to spend an additional $31 million to be able to even comply with the law and put the processes into place that are required around like work requirements and re-eligibility, those types of things. So it will create a hole in the state budget. It's going to make it harder for the state to fund, more of the things that maybe they funded before this bill took place or before this law was passed. So it's something that we're watching, and we'll keep you informed. Next slide. So some areas of concern in this this version of the budget that the governor has proposed. We know that according to the budget, the personal care attendant program, there's been a work group that's convened, and we're going to hear more from Tamara on this in a little bit. But that work group identified 32 million in cuts to help control PCA program spending. She'll give you some additional details in a few minutes. The adult day health and the adult foster care, so the ADH and the AFC, this is number 2, Austin, they created similar work groups, and they were created to cut 15 million in ADH and 35 million in AFC spending. There's also an impact to adult dental Medicaid services. Mass Health has, there's a proposed Mass Health budget cap of $1,000 per member per year. There are some exemptions for people who are DDS eligible, the Department of Developmental Services. That's what DDS stands for. And then the self-direction program. Funding levels are unclear. The budget line item for this particular service is combined with other things, and it's impossible to untangle and understand. Did it get funded more than last year? Is it the same? Is it less? So this is something that we're watching closely. And at the bottom of the slide, that link right there will take you to some information about, what self-direction is. We have 2 main service models in Massachusetts. There's the traditional model, and most people utilize the traditional model. We also offer a self-directed model, and there's 2 types of ways that you can self-direct. We're going to talk a little bit more about that too, because the MDDC just presented findings on a survey that we did about self-direction. Next slide. So I was just mentioning earlier this month on January, actually last month, because we're already into February, my colleague Caitlin Stober presented on the survey findings. We did a statewide survey, and we collected information from over 250 respondents from all over the state. And we now have the recording to the webinar where she presented the findings available on our website, as well as the slides in her presentation. And later today, we also have a shorter resource that captures what we found in the survey. Let's go to the next slide. There are some things that we found out about that have to do with the state budget. So that's why I've chosen to include it here. So in addition to finding out all of the important and powerful reasons why people choose to self-direct, to have greater control, to be able to individualize their services better than maybe what the traditional model allows you to do, there were some things that were a struggle for these participants. And one of the themes that we identified based on the respondent data was that budgets aren't enough to meet service and support needs. And in the light blue box to the right, there's a quote from a family member. We are glad and grateful to be a part of the PDP, that's Participant Directed Program. However, we are very concerned that this year DDS received a rate increase for day programs, and this person was speaking relative to last year, but has not applied these funds to group day activities under PDP, even though the day rates for the program has increased. This poses a real budget challenge for our family. So what we heard from the community was that Once you have like your PDP budget established, those budget levels stayed the same while the cost of the services were increasing. So participants are receiving fewer hours of services because of the increased costs. Let's go to the next slide. And there's the link at the bottom of each one of these slides that will take you to our website page where you can rewatch the webinar where Caitlin shares the findings, or take a look at these slides, and there will also be a short resource that's going to be put on our website this afternoon. So again, around that theme of budget, not enough to meet service and support needs, another family member. And by the way, I do want to note, we received 50 pages of single-spaced written feedback in addition to the questions that the multiple choice questions that people responded to. So folks had a lot of information to share. These quotes really capture the themes of all of the data that we received. This theme right here is specifically to around the budget. So this particular family member said, we have been involved in self-direction for 8 years. Our budget has not increased in 8 years, despite showing need and having to offer increased hourly rates to hire staff. This is not sustainable. Traditional programs have had increases. Why not self-direction? So this is something that, obviously we're watching. One of the reasons why we did the resource, in addition to putting our recording of our webinar online and also making the slides available. So we want to use it as a resource to help educate and inform policy makers and the department about what the community has to say about what their needs are and how their budgets are working. And that link at the bottom will take you to our page with these resources that has all of the information about our statewide survey. Next slide. Here's one more quote, again, around the topic of budget, since we're talking about the state budget. In the light blue box, this family member shared, my daughter's budget is helpful, but it no longer reflects the true cost of providing quality support. Staffing rates have increased significantly, and it is becoming harder to retain skilled workers within the current budget limits. An adjustment that keeps pace with rising wages and service costs would help ensure she can maintain consistent, safe, and meaningful support through self-direction. This is an area of the budget we don't typically hear a lot about. So the MDDC really wanted to raise the voices of the individuals who took the time to respond to the survey, especially when we identified this particular theme and some of the feedback. This is in addition to some of the very good things that are happening in self-direction that people do value the opportunity to individualize and create a program that fits their most individual needs or the needs of the individual and the family. That's not to take away from that, but this is something that, we need to be aware of and we need to talk about. Next slide. Oh, and I included one more with a couple more quotes here. Again, all total for the entire survey, we received more than 50 pages of single-space notes, but here are a couple more comments around that budget theme. In the upper orange box, it says, as previously noted, budget should increase annually. Initially, we paid 24 hours per hour for staff. Now we pay $35 an hour. This cannot continue. Needs increase as you age, costs increase, but the budget does not change. I was not aware that we can appeal our budget. And that was one family member. And at the underneath there's another comment from another family member. My son's aide works only 6.5 hours per day with no health insurance, no retirement plan, and no vacation or sick time. Pay scale has to be increased to maintain good staff. So clearly we heard from folks in this program that we've got to pay more attention to budgets and be tracking, like, are these increased over time? Are they keeping pace with increases in the workforce rate, workforce increases and the like, and other rising costs? Next slide. Certainly there's an opportunity for some advocacy. We do have a bill that is on our priority endorsed lists that talks about allowing payment for caregiving on the part of family members. Senate Bill 886 was sent to study, but the House Bill H 1394 would still change this restriction for all home and community-based service programs. There's a link where you can track the bill's progress on our website. You know, as a person from the DD community, as an individual or a family member, you can reach out to your legislators and you can share your story and you can let them know if this is a bill that would impact you and how it would impact you and how it might help you if it were to be passed. Next slide. All right.
So, coalition updates. Oh, first, I guess we'll go to Tamara with the PCA program update.
Thanks, Jossie. Hello, everyone. I'm here to give you the PCA update and what's happening in terms of the program. As for the budget, it continues to be challenging, and the proposed cuts are deep. Recently, Maura Healey released her budget proposal to the public and asked the PCA work group to cut the program by $68 million. This is in addition to the recommended $32 million that the work group already proposed back in 2025. This totals $100 million. So we're looking at $100 million in cuts. Next slide. There's a new hire paperwork process coming up late spring of 2026. And this is one of the biggest changes coming in the spring. The new hire paperwork process is a concern to consumer employers because they're unaware of the time it will take in order for a PCA to be eligible and work ready. Most of the time, employers require PCAs beginning work immediately or shortly after. This is not doable with this paperwork process in place. There is an online option, though, through a site called Paperworker. Mass Health states it is a 24-hour turnaround time to get this paperwork processed. These are the forms you'll need. There's current forms, the federal employee withholding certificate, the W-4, the withholding exemption, the I-9, the PCA provider verification agreement. There's an attestation form and a direct deposit, an avoided check or typed letter from your or the payroll debit card application. In spring 26, in addition to the current forms, consumer employers will need to submit PCA or direct care worker federally required employment authorization. Documentation includes photo identification, employment authorization documentation. PCA employment eligibility will now be verified by using E-Verify. PCA provider contact information. The following information will be collected from these PCAs, including their residential address, mailing address, email address, and telephone number. And also they'll have to sign a consumer agreement with these updated changes and send it to the fiscal intermediary called Tempest Unlimited and once for approval. And once they are approved, the PCAs will get in the mail a unique identification number as well as a start date of employment. So, does anyone have any questions? And if you need more information,
Tamara, are we still on the first slide?
No, we're on the second.
Oh,
Okay.
Now we're going to the third.
okay.
As for the complex care update, people who are eligible need proper documentation for digital rectal stimulation on the prior authorization from the doctor. And currently there's 931 people who have the prior authorization, and Mass Health projected a much higher number, 3,500, making the actual number result in cost savings. And next slide, immigration issues. PCAs that don't have the proper US paperwork documentation will be automatically terminated from their PCA roles. On February 3rd, a federal judge in Washington, D.C. issued a ruling that temporarily blocked the Department of Homeland Security from terminating a temporary protected status for approximately 350,000 Haitian immigrants. The court orders ensure that those with a valid employment authorization document, specifically with codes A12 or C31, can continue to live and work legally in the US while a lawsuit challenging the termination proceeds. And on slide 2, I forgot to mention that the PCA Mass Health is working with the PCA Workforce Council and looking for members of the PCA workforce community, the people that participate in the program, to help make forms user-friendly and accessible. And if you're interested in participating in this work group, you can contact me, and there's more information to come on that.
Tamara, can they go to that link that you included on your slide?
Yes.
For more information.
Yes.
Okay. So I'll give a brief update on the Rev Up Coalition. And actually, before I do, I just want to let the people know I heard the doorbell. If you came late, we're having some technical difficulties here, so I can't engage in the chat, and we can't put comments in the chat right now. But we will be sending all this information out after the meeting. So the MDDC, as many of you know, belong to the Rev Up Coalition, which is housed at the Disability Law Center. And they had a meeting end of January, and they're having another one in February. And what they do is they're a statewide coalition of organizations and individuals, many who have disabilities, statewide. And they Rev Up stands for Register, Educate, Vote, Use Your Power. So they educate people with disabilities about voting rights. They advocate for accessible voting processes. They help people with disabilities register to vote, and they encourage civic engagement of people with disabilities. So their next meeting is February 26th on Zoom at 1:30, and this link will be sent out. And I included a picture here of Justin Dart, who is known as the father of the American with Disabilities Act. And he has a quote, which is, "Vote as if your life depends on it, because it does." So we have a pretty big election coming up in the fall in Massachusetts. So we're going to be voting for governor, attorney general, treasurer, secretary of state. Also, there's a competitive United States Senate contest. So that's our statewide senator that goes to Washington, and all of our congressional representatives, and also all of our state senators and all our state representatives. So all the information that you've heard so far about policies and budget and legislation, that all gets, a lot of that gets decided on by these policymakers that we're going to be voting on. So we really want to have everybody be informed about what the elections are, not just the statewide elections, but also the local elections in your towns and cities, and to make sure you can vote. RevUp's also very big about voting accessibility and getting the word out about ways to vote, ways to report violations if you see in your town that for whatever reason it's not accessible at the polling place, or maybe the electronic machine for people with disabilities might be broken. So RevUp is very much engaged in all those issues. All right, next slide. So there's also a national RevUp group, which actually gives some funding to the local RevUp group. And so they are offering movement grants for up to $10,000 to small nonprofit organizations. So they're seeking grassroots organizations working to engage voters with disabilities and to increase election accessibility in their areas. And they're focusing on doing this with underserved communities. They're having a webinar tomorrow. And again, that link will be sent to you after this meeting, and the deadline to apply for the funding, if anybody's interested or any organization, is the end of February. Okay, I'm going to pass it to Jennifer. Oh, actually, I should ask, does anybody have any questions about what I just shared?
Or does Barbara have anything to add? Barbara L'Italian, I think you're on the call now from the Disability Law Center.
I am, and I couldn't have put it any better than Liz. The only thing I will say is with those, whatever they were called, organizing grants, the organization that wants to apply has to have a budget and an all-in entire budget of less than 2.5 million, because I've had a lot of people contact us and say, you should apply for this. Well, we already get a grant. So I don't think they'd give it to us, A, and B, our annual budget exceeds $2.5 million. This is really meant for smaller groups. So just want to be clear on that.
Thank you, Barbara.
Mm-hmm.
So the DD Council, MDDC, we also participate in a number of different coalitions. We have a couple more updates about things that have happened that might be of interest. We participate through the Massachusetts Alliance for the 21st Century Disability Policy, MA21, and it was formed back in 2007. And the intent of MA21 is to protect the right of people with disabilities to self-direct. And the work that we've been able to accomplish resulted in the passing of the Real Lives Law in 2014. And I wanted to point out that there's a new updated fact sheet. So the link at the very bottom of this slide will take you to the updated fact sheet that's titled The Real Lives Law Legal Status. So give you some updated information about the work that we've been doing. This particular document will give you a summary of how far have we gone in implementing the Real Lives Law. What were the provisions of the law? Like, what was supposed to happen? And it also has highlights of challenges that have been reported by individuals and families that are using self-direction. And the last thing I'll say is that this updated fact sheet also outlines next steps to help strengthen the self-direction program. You know, national research shows that individuals who self-direct, they have greater life outcomes in all measures, and they're more likely to work and be employed. And we know that this can be a very empowering model. With that, you need flexibility in the law so people can have the information they need to know how to do it, and maybe support for that to be able to navigate it with these independent facilitators. That was one thing that was required under the Real Lives Law. So for more information, definitely go take a look at the updated fact sheet, and feel free to reach out to us for more information, or if you want to get connected so that you're on their newsletter or the list so you can find out about their meetings. Next slide. This is one coalition that we lead here at the council, Guardianship Alternatives Innovation Network. The acronym for this is GAIN, G-A-I-N. The first bullet talks about how, we've led this coalition. Our primary focus is on guardianship alternatives. We are in the process of setting a date for March. I'm waiting for folks to respond to a doodle poll, and then we'll definitely make that information available to the public once that has been determined. But there was something I wanted to share with you, a valuable learning opportunity. The Center for Public Representation, CPR, a woman by the name of Morgan Whitlatch, she attends our GAIN meetings, and she's been a close partner on this coalition. And in partnership, CPR in partnership with this other group called Parent Professional Advocacy League, PPAL, they're going to be hosting a webinar 2 days from now on February 12th from 6 to 8 p.m. And the webinar title is Guardianship is Not the Only Option, Supporting Decisions in Adulthood. I am a parent. I have an adult daughter who experiences a significant intellectual and developmental disability. And when she was approaching transition age, I heard from school, I heard from doctors, I heard from the community service system, you have to go get guardianship. It was the only option that was ever talked about. And we were specifically directed to pursue it. There are a whole host of alternatives that are less restrictive that might be appropriate. It really depends on the individual needs of the person. So this webinar on Thursday, February 12th from 6 to 8 p.m., it's being hosted by CPR and PPAL, and could be a very valuable learning opportunity to learn more about what some of the options are and how you can support decisions in adulthood. The link for the registration is there, and I'll make sure that we get this out to you right away. Thank you. Next slide.
Okay, now it's time for some federal updates, and I will pass it back to you, Jennifer.
All right. You may have read in the news or heard on the news that President Trump signed a budget package, federal budget package last week. This package of bills reopened most of the government, which was briefly shut down. Congress is still making some decisions about the Department of Homeland Security's longer-term funding. They had some stopgap funding in the initial package, so that's yet to be decided. Go to the next slide. And you'll notice there's an article link on the bottom of each of these slides. It's from that publication, Disability Scoop. They're pretty easy to read. Articles about federal happenings, sometimes state. It is behind a paywall. However, you can only look at so many articles per month. If there's an article that you want to see and you don't have access to, reach out to me. I'd be happy to help you. So in that budget package that was signed by the president, it funded a number of departments: Defense, Treasury, State, Health and Human Services, Labor, Housing and Urban Development, Transportation, and Education through September 30th, 2026. So that's a very positive thing. Next slide. So what was in the spending plan? Well, the plan had language to keep special education programs in the Department of Education. This is really significant. The administration had talked about shutting down the Department of Education, had talked about moving programs out of the Department of Education. So the fact that there was language in this budget package to keep special education programs in the Department of Education was something that advocates were really happy to see. It also includes language to not allow IDEA block grants. Block grants are when they put a maximum amount on something, and even if costs increase over time, the funding stays the same, and that could hurt the funds, IDEA funds that support schools to be able to deliver vital special education services. So that was another positive thing. I will tell you, as a Developmental Disabilities Council, that they were essentially level funded in that budget package. Another thing that was positive, months ago, there was some talk about no longer having the USEDs. Remember, Jossie talked earlier about our DD network, University Centers of Excellence on Developmental Disabilities. Originally, those weren't going to be funded at all. And this budget package maintains the USEDs and some P&A protection as well for the protection and advocacy agencies. It also maintains the administration for community living, or what we know as ACL. They're sort of like our federal umbrella organization that has all of these disability programs. So that's something positive too. Our National Association of Councils on Developmental Disabilities, NACDD, that last bullet, they're working now on the next appropriation for the next federal fiscal year, 2027. And again, that link to that article is at the bottom. So yeah, we were pleased to see these particular things included in that budget package. Next slide. So there are things changing with Medicaid. We touched on this earlier with that cost of compliance slide. And we talked a little bit about that One Big Beautiful Bill Act, also known as HR1 or the Reconciliation Bill. Let's talk a little bit more about changes we're going to see in Medicaid. Next slide. All right, so the key changes are listed here on the right side of the slide in bullets. The first one is, more frequent coverage checks starting in 2026. There's also some financing changes in that second bullet. It says provider tax limits. States have to pay a certain share of Medicaid. Medicaid is a state-federal partnership, and in that bill, the One Big Beautiful Bill Act, or HR1, the Reconciliation Bill, it limits how states can tax providers. Providers like knowing exactly how much they'll be taxed, and generally were supportive of the provider tax because they knew what to expect. They could budget year to year, but this limits how much states can tax them, and it'll be more challenging for states to pay their share if they're limited in taxing these providers. So that's definitely a concern. There's going to be more paperwork. That's the third bullet. And the fourth bullet is stricter eligibility requirements. Also, the bullet underneath there, work requirements starting in 2027. Some people may lose coverage even if they still qualify because maybe they can't keep up with the paperwork that's going to be required to prove that they're working. Or maybe you're a person with a disability and one of those exemptions doesn't specifically apply to you because of the nature of your disability. It would be hard for you to comply with those. So the concern here is that some people with disabilities may lose coverage even if they still qualify. And then the last bullet there talks about Medicaid funding and administration changes. There are some significant concerns about how the federal reduction in funding for Medicaid and the Medicaid expansion will impact health providers and especially rural hospitals and low-income communities. So Medicaid isn't going to go away, but it is going to be harder for some people to access. Next slide. So again, we're still talking about OBA, the One Big Beautiful Bill Act, HR1, the Reconciliation Bill. Those are all different names for the same thing. And it includes $1 trillion in cuts. And of course, the work requirements, or they can also sometimes be referred to as community engagement. You'll see in the second bullet, say that people have to prove that they're working, volunteering, or going to school to qualify for coverage. And that third bullet talks about, states now, Massachusetts included, they're working to create the systems to comply with that bill and to follow the rules that were in that bill that was passed, OBA, HR1, Reconciliation Bill. So states are really grappling with putting these systems into place. And we know, we mentioned earlier, the millions of extra added dollars states will have to spend in order to be in compliance with this new federal law. Also, the Centers for Medicare and Medicaid Services, they issued some initial guidance in December 2025, but it's still not enough information. Everyone's looking forward to, we're expecting more clarification and guidance in 2026. Once that's available, we'll pass on some information to you. And the link at the bottom takes you to another Disability Scoop article that's really easy to read and understand. Medicaid changes could limit access for people with disabilities, advocates warn. All right, next slide. No, we're over time here. This is going a little slower than what we thought. We had a little delay in getting started. So thank you for your patience. So CMS guidance is going to exempt certain people or groups from the new rules. So if you're considered medically frail, what's the definition of that? States are going to have to, they'll interpret it. I'm sure there'll be federal interpretations of this. But if you're medically frail, if you have special medical needs, this would include people with physical, intellectual, or developmental disabilities. If you're a parent, guardian, caretaker, like a relative caretaker, family caregivers, those with disabilities are also exempt. But there are concerns that some people with disabilities and chronic health conditions, it might limit these new requirements, work requirements might limit their ability to find and keep work, and they're at risk of losing their coverage in that last bullet. And then there's the link to the article again. Next slide. There was a letter written by this group, this national group, the Consortium for Constituents with Disabilities. They issued this last fall. And again, it's just a reiteration of the concerns around those that won't be exempt, that the exemptions fail to capture everyone. And some people could, could lose their coverage, and that's a concern. Again, CMS, we are expecting more guidance and some regulations that will come out in 2026, and we'll keep watching for that. Next slide. So there is consensus among national advocacy groups. They have set out some recommendations that states can follow, and they agree that the first item here on the list, use existing data to verify eligibility. So we already have some eligibility processes in place. Use what we have to verify rather than mandating new paperwork. 2, provide assistance with applications and renewals as a reasonable modification or accommodation. 3, use broad definitions of medically frail and special medical needs. Each state will, implement it in a unique way. Some states may require more, where some states will only require what's absolutely necessary as laid out in the law. So we'll definitely see some differences on how this is implemented across the United States. And the 4th item on the list here, allow individuals to self-attest for exemptions and ensure that their notices, online portals, and other communications are accessible. And to read more information about this, you can go to the link at the bottom. Next slide. On February 5th, there was a really valuable webinar that national organization Justice and Aging hosted. They recorded that webinar. It talked about how states are implementing these new Medicaid work requirements, and they provide a number of strategies that states can use to minimize harm, in the state. So at the bottom of the slide, you can access, there's the link to the recording, the slides, the transcript, and they also have a toolkit. So if you have more questions about these work requirements, then this is a valuable and trusted source to get more information. Next slide. And I think this is still me, right, Chauncey?
Yeah.
So I wanted to let you know that Brandeis has released a new report. It's a 3-state study on Olmstead's effects on housing affordability, supportive housing, and home and community-based services. I had just received information within the last week about this. I think it's something that they've recently launched. And in that orange box at the bottom, if you click that link once you get the slide deck, you can go and you can read their report. But some of you might be thinking, Olmsted, what is she talking about? You might not have heard about the Olmsted decision. Let's go to the next slide. The Olmsted decision, it was actually Olmsted v. LC. It was a case about two women. The woman in the red jacket is, one's Lois Curtis and one's Elaine Wilson. I don't know if someone knows
Yeah,
who's
the one in the red jacket is Elaine Wilson, and the
okay,
one on the left is Lois Curtis.
Lois Curtis. So there was a court case, and these two women had been confined, like stuck in a state institution, but they were ready to live in the community and receive community services. And after years of nothing happening and being isolated, they sued the state. And the women argued that their rights were being violated under the ADA. And the court, in their final decision, they had this integration mandate, which helps to affirm people with disabilities' right to live in the community. There's a link in that orange box in the lower right-hand corner that will take you to more information about the Olmsted decision and this landmark case. Next slide. So a little bit more about the three-state study that Brandeis did, the Olmsted report three-state study. Essentially, again, the Supreme Court's decision says people with disabilities have a right to live in the community. I just mentioned that integration mandate that required states to take action to get people with disabilities out of institutions and into the community. And the report really looks at how the Olmsted decision has brought about positive change. And it looked at Georgia, North Carolina, and Virginia. So I'd urge you to take a look at that next slide. The report also describes what each state did specifically to improve access for community living. We know there's a housing shortage, and there's a shortage of accessible and affordable housing. So this report has a lot of valuable information. I want you to walk away knowing that Olmsted is an important tool to use to advocate for your rights. And I'm excited for you to take a look at the three-state study because it really illustrates examples of, how affordable housing was created at both the state and the local level. Next slide. A little bit more about the integration mandate. Here's a little graphic from Brandeis, the website, and their three-state study on the left. On the right, you see some bullets. So the integration mandate did lead to less people living in institutions or being at risk of, being stuck in institutions. It also inspired more state funding for supportive housing services and Medicaid waiver funded home and community-based services. And then the third important thing here in the last bullet is, despite this progress, there's still barriers to community living. We're still working on, affordable housing. We're still trying to work and advocate so that more housing can be created because there's a lack of housing. So these shortages are really making it hard, and it's driving up prices. Every single housing market in Massachusetts costs more than 100% of your Social Security. And for adult individuals who rely on Social Security in order to be able to afford a place to live in the community, that makes it very difficult. Thank goodness there are some things like Section 8 vouchers and other vouchers that can help with that. But it is still an incredible challenge. Again, there are links to this three-state study. Excited for you to take a dive into that, and the links are provided. Next slide. All right, I was hoping that maybe, I don't know if Barbara is still on the call, or maybe from the AGO's office, if she's still on.
Yeah, Barbara is here, and I don't know if AG office is still here, but Barbara's here.
You may recall, we've talked about Texas v. Kennedy, another lawsuit. It's been around for a while. Initially, there were, I think, 16 or 17 states. They had an objection to the inclusion of gender dysphoria as a disability. And then a number of states dropped off. And there's only 9 states that are left on this particular lawsuit, but the lawsuit has changed. It has shifted. At the bottom of the slide, you'll see a link for DREDF, DREDF. It's a valuable resource to go and find out more information about Texas v. Kennedy lawsuit. And there's also a link to a Disability Scoop article. Let's go to the next page and talk a little bit more about this lawsuit and how it's changed. So now 9 of the remaining states are challenging the right of people with disabilities to live and receive services in the community. Remember how we just talked about that integration mandate? Well, they're challenging this. These states say that the 2024 update to the U.S. Department of Health and Human Services regulations, this is related to Section 504 of the Rehabilitation Act, they're saying it's unconstitutional. So this is something that we'll be watching very closely. Did you want to add anything to that? I'm not an attorney or a lawyer. Barbara, did you want to comment?
I just want to be really clear, I'm not a lawyer either.
Oh,
I am going to put the states that are still in it. I think there was some great advocacy to get others to drop off, done by the DD councils, by the our group, concerted efforts to try to get them to jump off. But so keep going.
excellent. Oh, thank you for dropping the states, the list of states. So there are links there. Once you have the slide deck, feel free to go and check that out. Next slide. Again, a little more information. 9 states have the issue with the integration mandate. We've already talked about the rule, but it says that state and local governments and other entities receiving these HHS funds, Health and Human Services funds, must serve people with disabilities in the most integrated setting appropriate. And the rule also says that states can be in violation of Section 504 if people with disabilities are unnecessarily institutionalized. If states don't obey, then it could mean they lose federal funds. And apparently these 9 states feel that that's unconstitutional. So we'll follow this as it plays out and keep you informed. Next slide. All right, Jossie.
Okay, so now we're going to hear about some council and community events. You can go to the next slide.
Okay, so I hope you all know by now that we are having our legislative reception at the State House on March 10th. Refreshments and networking starts at 10 a.m. and then the spoken program starts at 10:30. And we have a link to the registration that will be sent out with the slide deck, and it's also on our website at mass.gov/MDDC. And if you scroll to the bottom, you'll see events. And I also wanted to point out this picture here of the State House. This year we offered individuals with developmental disabilities the opportunity to submit artwork to be put on our program cover. So this is a piece that will be gracing our program cover, and it was created by a 19-year-old. He lives in Westboro, and he uses an augmentative and alternative communication device, which is also called an ACC, and he'll be attending with his parents. So we're very excited about that. But we really encourage and hope everybody can join us there.
Yes, I also included a slide for our statewide designated self-advocacy organization, Massachusetts Advocates Standing Strong. I wanted to make sure that folks were aware that they do these statewide drop-ins. It's a valuable way to connect with other advocates in the state on Zoom, and to share on or talk about topics such as communication, relationship building, and independence. They're always welcoming new members. There's an email address, a phone number here. They meet the second Thursday of every month from 5:30 to 7, or the fourth Wednesday of every month, 4:30 to 6 p.m. And so feel free to reach out to them if you have an interest. Next slide. I also wanted to mention that the Boston Center for Independent Living, BCIL, they are offering these housing workshops. It's the first and third Wednesday of every month from 10 a.m. to 12 p.m. They take place on Zoom. or you can attend in person at the office, BCAL's Temple Place office. You would learn about affordable housing options in the Boston area, how to apply for subsidized housing, and where to look for housing. So for more information about BCIL's housing workshops, you can go to the link at the bottom to get information and to also register. Next slide. Also, we're excited to hear about the Disability Policy Consortium, DPC. They're one of our partners. They help, and we plan together the Generational Leadership Summit. And they are hosting an annual legislative briefing. And that's going to happen on Wednesday, February 25th from 1 to 4 p.m. It's in the State House in room 428, or you can attend online. Again, it's a valuable opportunity to learn more about issues that are impacting people in our community. And you'll be hearing from a lot of different people. DPC will talk about their priority bills. They'll provide some updates. And they have also been very active in their advocacy around the wheelchair repair bill that has been making its way through the legislative process. They do a lot of work around affordable housing, hearing aid coverage, and so forth. The link at the bottom will take you to more information, and that is also where you can register. Next slide.
Okay, so real quick, as many of you know, we're undergoing our 5-year state plan update, which is what we call a roadmap, which will outline all the work that we are going to be doing over the next 5 years. And we have been gathering public input over the last few months, and we will be doing another initiative in March and April to gather more public input based on what we've learned so far. So just keep an eye out for that. We will be announcing that over email and social media when that process is open. We really want to hear from people with disabilities, family members, our disability community. It's important. Your input will make a difference in driving the work that we do.
Yeah, and I would add, Liz, even a year ago, we did the people's priorities. 400 people from the disability community responded and shared their preferences or what their greatest priorities were and the issues that are of most importance to them. And then more recently, we did the self-direction survey. And then Liz and Caitlin will be organizing some more opportunities for the public input. So stay tuned, more information to come.
Okay, now let's hear from some of our partners. I know Mass Office on Disabilities is here, and so is the Disability Law Center, and the Attorney General's office is here. I think that they're still here. So who would like to go first to give us some updates?
Hi, this is Camille from the Mass Office on Disability. Just a couple of things if you're interested. I know there's been a lot of snow recently. We do have a guidance page on snow removal that might be helpful to people. And if you weren't aware, if you have questions about snow removal at public transit, the MBTA has put out some best practices on that as well. So that might be helpful for just general information at this time. Additionally, if anyone serves on their city or town's commission on disability, or if you would like to learn about starting a commission on disability in your community, we will be starting our statewide commission on disability meetings again soon. So I can drop a registration link in the chat for anybody who is interested in that. But as always, please feel free to send any questions, emojis if you have any.
Well, thank you. Appreciate that.
I'll go next if you don't mind. I don't think Ann Lynch is still on. I didn't see her. So here I was feeling badly that I had to come on a half an hour late, but it sounds like with your delays it worked out because I think I got most of the meat of your meeting. You've kind of covered a bunch of stuff. Our Rev Up meetings are going to be monthly. We're hoping to sort of broaden the circle of participants because it will be a very big election year. So trying to get folks to really be able to be good ambassadors to voter access, be it physical access, but also the ability to vote by your computer if you meet the criteria. A lot of people don't know about that. It was hard fought in the courts, and it's not really publicized by the Secretary of State. So that's another piece of what we'll be looking at in terms of this year, this election cycle. You mentioned the PNAs. Well, that's us. That's Disability Law Center for here in Massachusetts, right? So with Trump signing the funding last week, it really meant that at least for now, for this year, this should have been done by September 30th. But for this fiscal year that we're in right now, we will not be seeing cuts to any of our programs. And we, by the way, thought that we would be seeing significant cuts in about 4 of our different funding line items. So never say never, because there's been things that have been congressionally approved and they've been clawed back. But for the moment, we are in good shape, which is really great. The Texas lawsuit, we are really watching. The Center for Public Representation just did a whole overview about this in the meeting I was at right before this, a group called Dignity Alliance. Their concern is that because of where the lawsuit is being filed, there are different circuits around the country, depending on where you live. Where it's being filed in the Fifth Circuit, they're really concerned that it's a very conservative circuit that may very well find on behalf of those 9 states, and in essence roll back a lot of the backbone of the law that ensures that there's, funding under Medicaid for community-based programs. So there's sort of that larger fight there, and at the same time there is a fight that's beginning to percolate here as well, right? In terms of saw stuff in State House News last week where folks from Mass Health are saying, well, community-based services are optional, and that is true. So we really are going to have to step up our advocacy as we see things like what Tamara was talking about, PCA already offering, to cut 36 million and wanting it to go up to 100 million. Like that's going to be an advocacy fight to understand what that means in real terms for people who need PCAs. And there are others as well. And I think when I jumped on, Jennifer was doing the overview of a lot of the DDS involved line items. So, I would just say we all need to be aware. We need to gear up and be part of the MDDC ARC Day and the DPC ARC Day, if you can, the Disability Policy Consortium, and other opportunities just to check in with your legislators and let them know what these proposed changes mean in real terms for your life. So I think that's really the big stuff there. And that's probably it. But, these are really challenging times. I very much appreciate the deep dive that you do, and the slides that you put out for folks. I hope and trust those get disseminated well beyond who can attend these meetings. But that's really the heart of it right now, is just being on our guard, right, for both what's happening at the federal level and at the state level, because the feds cutting back on Medicaid money absolutely impacts our state budget. And we will see that. So now that the governor's put hers in, right, her version of the budget, the next step logically is to go and speak with the folks in the House, because they will write the next level of the budget in April. Then in May, it will be the Senate. And then, ultimately they will work together to come up with a budget for this coming year.
Oh, well, thank you.
Mhm.
And the other, I think those are the only partners here, so I think we're ready to move on to the next slide. Okay. Liz or Jennifer, do you want to address the poll link?
Yes, unfortunately, I can't put the link in the chat, but we do have a link to a poll.
Up to the top, Liz, does the little bar appear where you can click the chat? If you take your pointer and you go up to the top, does it appear?
Not seeing it. I can't see Zoom at all. It's a really weird, wonky.
Well, you know what? Stop sharing, and that
Okay.
way I can go in and I can drop it in.
All right.
And we can go to DD Community Public Input, Jossie, while I grab that.
Okay. Yay, my Zoom. Let's see.
Okay, so while Jennifer is grabbing the link for the poll, does anyone from the public or actually council members have any comments they want to make? Anything they want to add? Thanks,
Any
Jennifer.
questions
Any
about what we talked about? Okay, I see the poll in there. Okay.
And if you want to go back in, I think the final slide, Jossie, has the list of the remaining 2026 policy committee meeting dates.
Yes, and as you'll see, when we get there, there's no meeting in March because of the legislative reception, so our next meeting is actually April 14th. But then, yeah.
Could someone please set up a recurring meeting with the dates? Because today, when I hopped on, I had secured the date on my calendar, but there was no link in there. And then I went back and saw that someone had kindly sent around an email today. So I went in and that's how I got in. But it would be really helpful if you guys could just sort of send a recurring with the link in it.
Yeah, I did send a
If
reminder
possible.
today. Because we don't meet every single month, that's probably why we don't have a reoccurring one. You can see the dates now, I think, on the
Yeah.
screen. Are you sharing?
Yes. I can
So
see.
is it the same link every single time then? Because I've got it for today, but will that work on
No,
these other dates? No.
they've been individual links. And
Gotcha.
we
Okay.
do have a public registration. So everyone who serves on the council and our council representatives, they're invited through a calendar invite through Outlook that was set up. And for people not on the council, for the public and other folks in our community, we post on social media an individual registration link for each month, just so that we can track people as part of the information that we use to report federally to how many people are we presenting to, and for those performance measures as
Great.
part of our reporting.
Okay. I'll continue to plug in the dates then on my calendar and wait until sounds like fairly close to the date when you get the actual Zoom link.
Okay.
Yeah, we can look into it.
Great.
Appreciate your feedback.
Yeah,
Mhm.
thank you.
When the calendar invite was set up, the Zoom was put in there. I'm not sure. We're having some weird technical things going on today with being able to share on our Zoom. So I'm going to have to connect with EOTS. Thank you. We really appreciate your feedback, Barbara.
Yeah, I mean, I'm gonna make the time and prioritize you guys. It's just nobody wants to scramble and go find the link, you know what I mean? So,
Yeah,
but I'll
it
make
should
sure
be
these dates, and it's always gonna be 3 to 4, right? Or 3 to 4:30.
correct.
Yeah, okay.
Yeah, and there'll always be a council calendar invite that's set up for you too.
Awesome. Thank you.
Well,
Thank
thanks for taking the time to join us. And you missed the very beginning, but it took us a little while to get started with technology snafus. So appreciate everybody's patience.
Thanks. See you later.
Yeah,
Okay,
yeah,
have a
we'll
good one.
adjourn. So, see you guys later. Bye.
Alrighty, bye-bye.
Austin, do you need help to log off? Are you all set? And oh, I need to stop recording.
Austin, I'm so sorry I couldn't do that highlighting. My screen was just